Hello, my name is Dr. Diwan S. Raja. Today I will discuss about a few multiple choice questions in neurology. It is a continuation of our multiple choice questions in Neurology 1. Let's get the questions. Question number 1. A 50-year-old patient with chronic alcoholism is admitted with altered mental status of ophthalmoplegia. That means the extraocular muscles are not working, they are in paralyzed condition, and ataxia, that means type of imbalance. Laboratory investigations reveal low serum sodium level. Following correction of sodium level, the patient develops quadriparesis. All four limbs are weak and not functioning, and dysarthria, he cannot speak properly. MRI shows characteristic findings in the central pons. Pons is a part of the brain stem. What is the most likely diagnosis? Wernicke's encephalopathy, multiple sclerosis, central pontine myelinolysis, Parkinson's disease, stroke. What is the correct answer? So this is the MRI, this is the pons area, and here is the characteristic finding, and what is the diagnosis? Answer should be central pontine myelinolysis. C is the diagnosis. Okay. Now go to the second question. A 40-year-old man with a history of alcohol abuse presents with acute onset of difficulty in walking, dysarthria and dysphagia. Physical examination reveals bilateral weakness and hyperreflexia. MRI demonstrates symmetric hyperintensity involving the central pons. What is the most likely diagnosis? Wernicke's encephalopathy, central pontine myelinolysis, multiple sclerosis, Guillain-Barré syndrome, cerebral infarction. What is the correct answer? Again, correct answer is central pontine myelinolysis. MRI is diagnostic. Symmetric hyperintensity involving the central pons. Okay, question number 3. A 50-year-old woman presents with acute onset of severe back pain followed by progressive weakness and sensory loss in both legs. She received a flu vaccine 1 week ago. MRI of the spinal cord reveals hyperintensity consistent with inflammation. What is the most likely diagnosis? Spinal cord injury, post-infectious myelitis, neuromyelitis optica spectrum disorder, post-vaccination transverse myelitis, cervical spondylosis. So here is the problem. Here is another problem. Same thing in different way. This is the problem. Here is the problem. So what is the most likely diagnosis? Diagnosis is D. D is the post-vaccination transverse myelitis. This may happen rarely in vaccination. Question number 4. Okay. A 25-year-old woman presents with sudden onset of weakness and sensory loss in both legs, as well as bladder dysfunction. She has a history of systemic lupus erythematosus. Systemic lupus erythematosus, SLE. MRI of the spine shows hyperintense lesion involving the thoracic spinal cord. What is the most probable diagnosis? Choices are spinal cord infarction, neuromyelitis optica, cervical spondylosis, lumbar disc herniation, transverse myelitis. So, what is the diagnosis? Answer should be the E. E is the transverse myelitis. There is the answer, transverse myelitis. This may happen in a patient with SLE. MRI can diagnose the disease. Okay. And sudden onset of weakness and sense in both legs as well as bladder dysfunction. History of SLE that may lead to transverse myelitis. Okay, a previously healthy 25-year-old woman presents with acute onset of confusion and seizure. She had a recent history of varicella infection. Neurological examination reveals bilateral upper limb weakness and ataxia. MRI of the brain shows asymmetric white matter lesion like this. This is asymmetric. Both sides has lesion but not similarly. Involving both cervical hemisphere. What is the most likely diagnosis? Okay. Acute disseminated encephalomyelitis, stroke, Creutzfeldt-Jakob disease, herpes simplex encephalitis, myasthenia gravis. What is the diagnosis? There is history of varicella infection. 25-year-old women, acute onset of confusion and seizure. MRI shows asymmetric white patches. Okay, so what is the diagnosis? Diagnosis should be acute disseminated encephalomyelitis. This acute disseminated encephalomyelitis. So answer should be A. Okay. Stroke does not show diffuse lesions, white matter lesions, asymmetric. Myasthenia gravis is a problem of neuromuscular junction. Herpes simplex encephalitis. Okay, there should be history. Usually it involves the posterior part of the brain. Okay, not disseminated like that. So our answer is A, acute disseminated encephalomyelitis. Okay, and that's all about the MCQs in Neurology 2. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.